You're watching TVC Breakfast. 1 in 5 young Nigerians have never tested for HIV/AIDS.
This is rather worrisome because many youths are sexually active. Senior correspondent Ivy Kanu tells us about the need for early detection among youth.
Young people aged 15 to 29 have the highest prevalence of HIV in Nigeria, yet most of them remain untested. A recent survey by the Nigerian AIDS Control Agency estimates that adolescents aged 10 to 19 years in Nigeria living with HIV is put at 160,000. There are fears the numbers may have risen due to lack of enlightenment programs. NACA also puts the prevalence at 4.2% for young people aged 15 to 24. But we asked young people if they have ever tested for HIV and how often they do.
Yes, absolutely.
When was that?
About 3 months ago.
Last time I went to the hospital, I checked and it was negative and it was okay.
I've not done it before. I've done HIV test before.
Yes, I've done it.
At this program are 13 groups consisting of 4 youths, each drawn from across the country. It is the very first HIV self-test kit program tagged Designathon. It is likened to pregnancy self-test kit. Each group was asked to brainstorm and come up with the most appropriate way it can be accepted by the youths. This is to drive innovation in the medical field.
Through HIV self-testing, many young people can pick up a kit in the privacy of their own homes, get to begin to know their status. Because what you find out with many young people is that they're not showing up in the clinics. We're saying, can they now be the solution? There is a problem, many of them are not testing, but can they offer the solution to ensure that they themselves and their fellow youths begin to test?
The message is clear. It is all about early detection. Prevent if negative or go for treatment if positive.
All right, joining us now is Ibrahim Umar, HIV/AIDS treatment activist. He's joining us on Skype. Now, Umar, it's good to have you join us this morning. Well, when you talk about the issue of prevalence of HIV/AIDS in the country, there has been a lot of awareness campaigns. How impactful has that been?
Well, thank you. It's my pleasure to join you this. And it's straight to your point. Yes, the awareness campaign has made some efforts. We've covered some mileage. If you remember from the initial times, when you talk about HIV/AIDS, what comes to somebody's mind is skull and bones, crossbones. But now the issues are different. But the truth is this, it's not yet time for Uhuru because we are not there yet. There are still a lot of fair persons outside, particularly in the rural areas, that are not really versatile with the real information. The media has gone down. I'm happy TVC is taking this up because most times when I meet my media brothers and sisters, I tell them, must let everything end in the politics, but you need human beings. I'm happy TVC is taking this up. So the awareness, there is still much that needs to be done.
Now, when it comes to staying with the issue of awareness and advocacy, 2-3 decades ago, there was massive enlightenment campaign and awareness creation. What has been the difference between that time and now that you say the enlightenment is going down?
Well, the difference is this. At that initial time, it was an emergency. We needed people to come to stay alive. Now we have been able to prove with structures on ground that HIV is no longer a death sentence. At that time, it used to be a death sentence. We now know people living with HIV can live a healthy life and a very productive life. We now know that even women living with HIV can have children who are HIV-free. Those are good things. And now, come to here, it has got to the point that we now know treatment is a form of prevention. That's where we have women living with HIV or a man living with HIV, maybe in discordant relationship. When they take their drugs to a particular stage, they can no longer infect their partner. That is wonderful. But when you talk about awareness, there is still a lot that needs to be done. And that is why it hurts that the government is not investing much into that. we see so much downturn from the media. And the truth is this, if an issue is not in the media, then it's not an issue. And that is why I'm really happy that TVC is taking this up. Kudos and thumbs up.
Okay, Ibrahim, thank you. Now, when it comes to the issue of testing, at what rate are people testing, even for those who are aware of the prevalence of HIV/AIDS? How often are people going for a test?
If you look at, to be honest, from the program perspectives, I must be honest with you, less than 50% of Nigerians have ever had an HIV test. Less than 50% of Nigerians have ever had an HIV test. Let me give you one funny scenario. I used to work with a medical doctor who was the head of a prevention team. And I asked him, Oga, have you had this test before? He said, Oga Bodu, that is not easy. Say, his wife, during my antenatal got tested, I said, what? But I know of what to call about discordant. I know aware of discordant couples. He said, oh, those came with that. That is for a medical doctor who is practicing as a prevention specialist. So for the general population, there is still a lot of people outside there who have never had an HIV test. And that is why we need to work on our service providers, on the structures of our facilities to be friendly, to be welcoming.
Now, about 1.9 million Nigerians still live with HIV, and there is the National Strategic Framework that by 2021 we should be achieving zero new infections, zero AIDS-related deaths. But, and this is supposed to guide our response to the epidemic. When you look at this, can we really achieve this? How challenging will it be?
Well, thank you. It's interesting to hear this. All these postulations, considering where we are, we keep making these postulations driving on donors' perspectives. I think what the recent studies has shown, NICE has shown, wonderful concept, it has given us a clear path of what to do and how to go about it. But I ask, how much is Nigeria putting on the table to say we are going to achieve that in 2021? It's just 2 years away from now. Look at our budget to health. Then come to look at the HIV implementation itself. We have a country that has this kind of burden, and our implementation is driven by donors with over close to 90% or more.
So what does this speak? What does this say of us as a country at achieving this? Does this show our willingness or political will to really achieve this by 2021?
Well, I will not say I am sick and tired, but I think we should do away with all these bogus political statements and not backing it up with real actionable works. We've had a lot of declarations in this country. We've had a lot of political statements in this country, but how much have we done? Have we done the talk? We do the talking and not doing the work that will clear the talking, that will back up the talking. That is it.
Well, we have to leave it at this point. Ibrahim Umaru, HIV and AIDS treatment activist.